So talk a little bit about the form factor of ketamine when you're doing it virtually. Because I understand that there's several different ways that you can take ketamine, and they all have pros and cons. Talk about how you guys do that right now.
Yeah, absolutely. Let me just preface everything by saying I'm a tech entrepreneur and I'm a ketamine patient, a psychedelic enthusiast, but I'm not a doctor or clinician. I work with a lot of trailblazing, brilliant expert psychiatrists and clinical researchers and psychiatric nurse practitioners and coaches, but I'm none of those things. So this is my personal viewpoint. Yeah, so there are a variety of different routes of administration for how to get ketamine into your bloodstream that different providers will use. There's intravenous injection, so like into your vein. That's what predominantly is leveraged at most ketamine clinics. There's intramuscular injection, which is into the muscle. There is intranasal, which is into your nasal cavity. There's sublingual, where you dissolve the medicine in like a tablet into your sublingual and buccal membranes. It's like under your tongue and in your cheeks. And then there's also oral, where you swallow it. So the first four that I mentioned, intravenous, intramuscular, sublingual, and intranasal, they have different bioavailabilities, but they're all just loading ketamine directly into your bloodstream. Taking it orally can be slightly different in that the way it's broken down in your system will also create what's called norketamine, which can be a little more sedative. So you don't see people using an oral formulation where it's swallowed as often. Subjectively, people can feel like a little groggier and more sick with longer lasting effects that aren't shown to be antidepressive. The formulation that our clinicians prescribe at Mindbloom that we've partnered with are sublingual formulation. They found that has just been a more effective and just experientially positive and pleasant route of administration for clients on the Mindbloom platform. And yeah, so that's dissolved under the tongue, spit out after about 5 to 10 minutes. And then it's about an hour long experience where people are undergoing the height of the therapeutic effects or experience before curtailing into integration practices and the afterwards in the days ahead.
So talk to me a little bit about dosing. It's one of these things that it seems like it's a little bit counterintuitive, where you might expect a big 6'5", 250-pound guy to need a super high dosage of ketamine versus a very petite person. And that's not always the case, right? Can you talk a little bit about that and maybe what you're starting to uncover with some of the data from these initial sessions that you're administering?
Yeah, I think a lot of protocols that we've seen will use weight as an input into an algorithm to pump out the dosage. And anecdotally, what our clinicians have seen over thousands of sessions is that in practice, there's probably a low correlation between weight or size and somebody's sensitivity to the medicine. One of the things the clinicians have been finding is that people who come in with anxiety or express a lot of anxious tendencies generally require a higher dose in order to reach the same therapeutic threshold as somebody with depression, or even somebody who has like some sort of mindfulness practice where they can sink into the medicine. Mm-hmm. I was recently chatting with, I believe it was Paul Austin at Third Wave, and he unprompted was telling me how Stan Groff, who's one of the, if not the like godfather of psychedelic therapy, had noticed that people with a neurotic personality on different sort of personality tests or profiles required higher doses of LSD or other psychedelics in order to reach the same therapeutic effect. So we haven't run any clinical studies on this yet, but it is data that we're collecting in terms of different doses for people and what the dissociative level of the experience is for them, how their symptoms trend over time, potential side effects, which are really rare, in order to start piecing together how do we figure out how to get the right dose to the right patient at the right time. In practice, what the clinicians just do is dose people really low and then titrate them up as needed.
Mm-hmm.